9 o'clock. Yeah, under that. Morning, how are you? Living every Saturday, 9 to 9:30. You tune in, we talk about life. Living with all type of diseases, all type of problems, whether it's poverty, whether it's economic issues, whether it's health issues. We're all about living, because living itself is stressful and we gotta deal with all of these issues. Good morning to you. How was your week? We were looking forward to come back and join you today, but lively up yourself today. It's a nice day. A lot of people didn't live to see today, so thank God for life and living. And today we have for you, remember last week for you guys who were listening, I want to thank you so much for taking your time in the morning to just sit down and listen to us and we talk about living. And don't forget to call us today. We got Dr. Simone Harris today, optometrist, and we talked about eye diseases last week. So 434-1771, 434-1790, 434-1791. You call us and speak to your optometrist. We'll talk about eye care today. Now, this program is for you today. You're not going to get Dr. Harris every week, so call. 434-1771 is your program today. Any eye problem, eye care, things related to small little things that bother you. You wake up and you see spots at the periphery of your eye and stuff like that. And you're diabetic or you're hypertensive and you want to know how you can keep your sight. Call us. So, the eye and small brain right there in that face of yours. Green eyes, blue eyes, brown eyes, black eyes, I don't care what it is. All eyes, and losing your sight, then easy. Talk about the iris, and we talk about the sclera, the cornea, all these are parts of the eye. You know, the eye looks like the camera. Anyway, Doctor, mornings, Simone, how are you?
Morning, I'm
Tell
good.
us a little about yourself, Simone.
I'm an open book.
Well, we just want to read a little bit this morning.
Well, I've been studying really most of my life. Moved back here in 2009. Started my own practice in Oistins.
Where did you study?
I did my first degree in Texas. I did my second one in Florida.
Florida, so you can speak like the Texan? So you moved around here. So you're well-trained, man.
Yeah,
well-trained.
moved around.
Oh, good,
yes,
man. So you bring all of that wealth of information. You see, you don't have to go to the States right now to get good care, man. We bring that stuff down here, don't we?
Exactly. We actually have very well-trained optometrists and ophthalmologists on this island. I'm proud to have them as my colleagues.
You see that? You tourists and all you people out there, so you don't have to run out of this country. You want to get eye care. You got some wonderful, top-notch people who are well-trained to help you care for your sight. So, 2009, you came back and you set up. Where you practice now?
I have a small practice there in Oistins. It's called Eye Focus in the Southern Plaza complex. And we're doing really well.
Good.
Seeing a lot of people, meeting a lot of great people.
So you open like 6 days a week?
I'm open 6 days a week, Monday to Friday. I'm there from 8 to 4:30, and then on Saturdays I'm there from 9 to 2.
Oh, man, listen.
Except for if I'm on the Sparman show.
That is right after you go. You leave here, you in that car, and you heading down to your office.
That's right.
That's good. I mean, I like your personality. If I'm going to have my eye looked at, I think I'd like to talk to a doctor like you, sitting down there smiling, at the same time giving me all the knowledge. Let's talk to some more people outside. You have somebody in line? Good morning.
Good morning, doctor.
Good morning.
Yes, I'm calling to find out about a cyst, what a cyst really is.
A cyst?
Yes, please.
Oh, okay. Well, you can hang up and just listen and I'll tell you about it. Basically, a cyst is just a small little containment of you'll find it in all parts of the body, and it got fluids in it. So it's a little bit of, if you want to simulate it like a shell, think about an egg. a portion of the, whether small or big, a little tissue that's enclosed, and fluid is in there. It could be blood, could be all kind of serious fluid. It can be just plain, good old fluid, transparent like water, things like that. But once it's contained liquid in it, it's called a cyst. And sometimes it's pus and stuff like that, but any type of material like that. Then sometimes its counterpart is tumor, where you'd have the solid counterpart. But once it's that shell of tissue enclosing some fluid, it's called a cyst. Okay, we got another caller. Good morning.
Good morning.
How can I help you? You have Dr. Harris on.
Yes, I'd like to speak to Dr. Harris.
Please.
Yes.
Hi, how are you?
I'm fairly well, thank you.
Good.
Yes. Is there anything you can do to prevent glaucoma and cataract?
Okay, if you have a family history of glaucoma, it is very important that you get your eyes checked at least every year, right, to make sure that it doesn't develop. All right. Do you have a family history of glaucoma?
My mother had a little.
Right. So it's important that you get your eyes checked every year. If it is detected, the ophthalmologist just puts you on a regime of drops to try and keep the pressure down as low as possible to prevent further damage. As far as the cataracts, I like to tell my patients, I mean, you live long enough, you probably will develop cataract. It's just a lens opacity, right? So as you get older, the lens is going to grow and get fatter, and as it gets thicker, the light doesn't pass through it. So as far as preventing cataract, I don't think you can prevent the formation, but you can slow down the progression of it, right? You understand what I mean?
Yes.
Right. So things like not smoking or protecting your eyes with really good sunglasses, not the cheap ones off the street, but maybe a pair of polarized lenses, right? All that protects the eye, and it helps to slow down the progression of cataract formation.
Oh, but if you get your glasses tinted, would that be okay?
Yeah, you can get your glasses tinted. There's actually a feature on a lens called a transition, where when you go outside, it turns dark.
Yes.
You come back inside, it turns clear again. So that's a pretty good feature that helps to protect the eye as well.
Okay, thank you.
All right.
Thank you for calling, ma'am.
Good morning.
Hello. Good morning.
Good morning.
How can we help you?
Yes, I have a problem with my stomach.
Oh, okay. What's the problem with the stomach?
I'm feeling like when I burp a lot, I get sound like water in your stomach.
Oh, boy, yeah.
And my mouth always have this acidy taste. I can feel it all in my temples, sometimes like when you eat a sour orange.
Yeah, I see. But yeah, a lot of times you see the acid in your stomach. Basically, it's got an acid taste, as it says. So a lot of people who've got something called reflux, where the acid just comes up into the esophagus, which is a tube from the mouth to the stomach.
Yeah.
It'll come out. Sometimes it's so bad it comes all the way up to the mouth in your taste.
So you don't get rid of it?
Yeah, there's some things you can do, but first medicines, because of medicines that would turn that acid into water. The doctor, you see your one a day, it neutralizes that acid and takes away that bad taste, and even helps you with this type of, when you belch and so forth, it helps you with all of those things. So one tablet can make your day wonderful. Thank you for calling.
Okay.
Good morning.
Good morning.
How are you?
I'm fair, thank you.
How can you have Dr. Harris and me on the line? How can we help you?
Well, I'm getting a light in the right corner of my eye. It's like a flashing bright light. And it does not happen like constant, but like every now and again. It doesn't matter what time of day it is or night. I get this flashing light. So I just wanted to know exactly what that was. And in the left eye, sometimes when I wake up, this eye feels as though it's not focusing and it feels tight. And I'm getting pain in the eyes.
You don't have diabetes, do you?
No, I don't.
You don't have a pressure problem?
No.
You don't have anything like cholesterol problem?
No.
All right, good. So I'll let Dr. Harris answer for you.
Okay. As far as the light is concerned, it could be a serious problem. It could be nothing at all. Do you get little black spots as well?
Yes, I see those floating that
Right,
spot. Yeah.
right. Those are called floaters.
Yeah.
Okay, it could be a problem with your retina because on the retina, which is the lining at the back of the eye, right, it has all these what you call photoreceptors, and you need those to see. And when this comes away from the retina, it's called a retinal detachment, and which can be really serious. And you kind of see that sparkly effect, like fireworks and stuff like that. What I would suggest is that you go to see an ophthalmologist so they can dilate your eye and have a look to see if anything is wrong, make sure the retina is where it's supposed to be, right? And that's usually, once you don't have any blood pressure problems, that's usually what the problem is. So I would get checked out as soon as possible.
Okay. Thank you very much.
You're welcome.
Have a beautiful day.
Thanks for calling. You listen, so thank you for calling there. You know, there's so many diseases and entities, and I'll talk to Simone. Myself and Simone going to talk to you a little later about diabetes and hypertension, high cholesterol, how it can affect your eye, and how you can control these things so that you can, the progression of the disease would be attenuated. We want you to express yourself. It's 424-1771, 424-1791, 424-1790. Dr. Alfred Sparman, Dr. Sparman at sparmanclinic.com. And don't forget, go on YouTube and press in Dr. Sparman YouTube. You'll see all these programs. We got it up there for you. You miss it in the mornings, just go in there and look at it and listen to your program and search. Anything you want to see, it's right there. Express yourself. Charles Wright, we'll be right back. Express yourself, man. Taking you all the way back. Charles Wright, I could imagine him just skating across the room, man. Express yourself. Yeah, whatever you feel like doing, you do. And whatever you feel like saying, you say. I want to big up my favorite scrub nurse, Karen. One of the best scrub nurse I've had, and her wonderful family. Karen, miss you so much, man. You're on vacation, but girl, come back and let's help some people and save some lives. I want to thank you so much for being with me all these years, Karen, and your wonderful family. And Tricia, your birthday's coming up on Thursday, girl. Big up to you. I'm going to have to make sure, by the time you're finished with me. I'll have a very light wallet, but it's okay. You all good. Big up, happy birthday, pre-happy birthday coming up on Wednesday. That's Tricia. Here we're back with you and talking about eye care. Good morning.
Good morning. I know you're speaking about eye care, but I would like to know if there's anything that can do with a fatty liver.
Ooh, fatty liver, yeah, God, yeah. You know, a lot of things can cause fatty liver, but one of the most common causes of fatty liver is alcohol, and I hope you weren't drinking a lot.
No.
But other things can cause fatty liver, and what if we follow these things? If the liver is enlarged, or if it's not enlarged and it's fatty, we just follow and see how it is by liver function. There's nothing you can do. But one thing you don't want to do is drink alcohol. On top of a fatty liver, you'll destroy your liver cells. So if you're told you had a fatty liver, make sure you get liver function tests done every year and follow to make sure it's not rising. You can live with that for a very, very long time, but you have to follow it. And certain type of medicines, when you take them, make sure you inquire from your doctor if it's toxic to your liver. So those are things you would have to follow with your doctor, make sure the medicines you take would not make your liver worse or give you more liver problems, and also stay away from alcohol. That's what I do. But there's no real cure for it.
Okay, thank you.
Pleasure, man. Good morning.
Good morning, Dr. Sparman. How are you this
morning? Not bad, ma'am. Morning.
Good morning to Dr. Harris.
Yes, please.
Good morning.
Yes, I would like to speak to Dr. Harris.
Please do.
Yes, what is blepharitis to the eye, and what caused it, please?
Blepharitis is one of the lid diseases. It causes like a crusting, right, on your eyelids. It can be treated very easily, right? But if you don't get it treated, it can the crusting kind of like dandruff. You know, like how you have dandruff in your hair,
Yes, please.
right? right? It can do like that crusting on the lashes, and this can fall into the eye and infect the eye further, right? So what you want to do is make sure you go and get treated for that and keep the lashes as clean as possible. Okay.
Well, I get treatment for the stomach to clean it with baby shampoo. But I still getting it because when I went back, it's still there and it's stopping me from getting the cataract cut, and it has my eyes very cloudy.
The cataract has your eyes very cloudy.
Oh, is it cataract? Oh.
Yes, it's the cataract that has your eyes very cloudy, not the blepharitis.
But I have one of the eyes cut already, and that eye that cut is what has the blepharitis. So
what you should do is go back to the ophthalmologist, right? And they can possibly give you further treatment for it, right? Besides the baby shampoo. Baby shampoo, that's making sure the lids are kept clean, and that's the first line of defense. But if it's persistent, you might want to get on possible medications.
Okay.
Right. So see your ophthalmologist, and they should sort you out.
Okay. Thank you very much, ma'am.
Thanks for calling. Good morning.
Hello, good morning. Can you please tell me, at the first discovery of cataract, can it move, or are you going to wait a while?
If it's bothering you, right? Usually the rule of thumb is if it's bothering you, then we would do something about it. But if it's not bothering you and the vision is okay, then we would not trouble it. Leave well alone and let it, as they say, mature a bit, and then do something when it really starts affecting your vision.
Oh. So in the case of, I know you said that, seeing these little floaters, I have to, you used to see them and then it stop making your nerves, calm down. Is it always a case of a detached retina when you see these little, floaters always, or?
No, not at all. What's happening is the, inside your eye is like it has a jelly type thing called the vitreous.
Oh.
And when the vitreous breaks down, like if you leave the bowl of Jell-O out, and the Jell-O is not as Jell-O-y anymore, right, all you're seeing is bits of this Jell-O floating around inside your eye. You see the shadow of it, really.
Oh.
Right. So usually people like boxers and stuff that get a lot of blows to the head, or something as simple as getting out of bed too fast, a sudden movement can cause a bit of the Jell-O to jelly, not Jell-O. You don't have Jell-O in your eye, okay?
So in the case then it happens, but then it goes away. That's not detached retina.
No, not at all. Sometimes it's not that it's gone away, but you have gotten so used to seeing the little black thing that you don't see it anymore.
Oh.
Right?
Oh, but it seems like it can go away though. Or?
It like I said, it doesn't really go away. It's just that you're used to seeing it. So it might be there, but you just don't even realize it's there anymore.
Oh.
Okay.
Oh. But I mean, I used to see it one time, and then I didn't used to see it anymore. But then as soon as I hurt my neck, if it hurt my neck, it will return, and then as my neck gets better, when my neck nerves in my neck gets better, then I won't see it anymore.
It actually might be the position where you hold your head. If you have like a crick in your neck or something, right? It might be the position that you have your neck in, causing you to see it. Right?
But it's not detached retina?
No, not at all.
Oh, okay.
Not at all.
Thank you very much, doctor.
You're welcome.
Well, thank you. As a matter of fact, yes, that detached retina occurs a lot to patients who are diabetic and people who've got a lot of hypertensive disease. Am I right, Dr. Harris?
Yeah. Detached retina is really the main cause from that is trauma, some kind of trauma.
But if you have these pre-existing conditions like what you mentioned, diabetic people and so forth, they're probably predisposed, would I say?
Predisposed to a lot of other stuff, a lot of bleeding at the back of the eyes, which can create a whole other set of problems. Yeah.
So if you get, suddenly this thing can happen, sudden detached retina, what are some of the symptoms you get?
Oh, well, you see a lot of floaters, those little black spots. You see flashing lights. you can actually feel like if it would look like a curtain is coming down over the and you notice that the vision just isn't as good anymore, and if somebody is experiencing that, I suggest you go straight to casualty or to your nearest ophthalmologist as soon as possible.
You can get acute blindness from that, from a detached retina.
Of course, and some of the times there's no going back. Once it's off, sometimes it's hard to get back on there.
Would you say the incidence of detached retina increases when you have glaucoma, when the pressure in the eye is very, very higher now?
No, not really.
You have other problems.
Problems like high myopia. So if you are very nearsighted, if your prescription is like -6 and above, like I said, if you are into a lot of contact sports, things like that, any type of trauma, right?
So that's very acute. But most of the people would have the cataract, which is a slow thing creeping up on you.
Right.
Glaucoma slowly creeping up on you. The pressure just causing a lot of enlargement of your blood vessels within the eye, nicking and all those type of things. But these are things you see commonly. And you think that if we normally encourage our patients to just control their pressure, keep it down, keep the pressure in your eye down.
And watch what you eat. Watch what you eat is very important.
Could you look in someone's eyes and tell if they're ready, they eat a lot of the Western diet, or you can't really? Do you see a lot of plaquing there, people who eat a lot of fatty foods?
Yes. Cholesterol, fatty deposits, they deposit not only on the back of the eye, but they deposit on the front of the eye. So a lot of young people, if you see that little white ring around the iris, which is the colored part of your eye, I would go and get checked for cholesterol, for my cholesterol levels, because this is something that happens usually as you get older. So if you were 65 and above, you would tend to see what you call arcosinellus, that little white ring. It shouldn't be when you are younger.
Well, I want to thank Dr. Harris. The time and constraints of time would prevent us from going further on. But we want to thank you for taking your time to come and and making the people of this country aware of eye diseases. Go and have your eye checked out. Every you wear glasses, every year or two, go check it out. Make sure that your eyes are intact. I want to thank you for coming. Really,
Thanks for having
taking your time off from your practice to come here. And guys, don't forget Switch is coming out. Switch is the sequel to 1.58 Seconds. Wonderful fictional novel in a few weeks. So thank you for listening, and we'll see you next week. Hotel California, the Eagles.
The boys on Barbados. On Barbados.